Hi guys, it's Crystal here, and I'm here today with Dr. Banani. Dr. Banani, can you please introduce yourself?
Yeah, my name is Banani.
And Dr. Banani works here at our clinic here at Greenville. So today we are going to be discussing the COVID-19 vaccine. I'm going to ask you some questions, Dr. B, and then if you just want to answer them, please. So our first question here is, are the COVID vaccines less effective against the Omicron, the new vaccine variant?
That's a really important question, Crystal, and I want to make sure that I answer that as accurately as possible. When the Omicron variant first became really prevalent right around early last summer, there were concerns about the fact that the spike protein on this new variant was so different than the previous ones that it may cause a problem for people who were previously vaccinated. Now, with that said, I never saw any data, any research papers that showed that the vaccines were not effective. But I know that pretty shortly after that, the booster was developed specifically for the new spike protein that was on the Omicron variant.
Perfect. Thank you, Dr. B. So adding on to that question, will we need to get another booster vaccine in the future?
Another good question. I'm sure like a lot of people heard rumblings about that. Nothing official though. There's nothing official on that from the sources that I go to for information, like the CDC or the California State COVID tracker. I can't really answer that right now. I think we'll just kind of have to wait and see.
Perfect. Thank you, Dr. B. Question number 2. Are 2 shots of the COVID-19 vaccine able to reduce the risk of hospitalization and death? If so, by how much?
That's a really good question, and the answer to that is an emphatic yes. I can tell you that if you just kind of go back to what everyone's experience was like early in the pandemic, before there were any sort of, vaccinations or anything to kind of help you with the virus, from what I remember, was during that time, hospitalization rates were very high. If you were a person who fit the risk factors for having moderate or severe disease, your likelihood of ending up in the hospital and then ending up in the ICU beyond that were greater than 50%. Now, while I can't give you a number as far as how much that reduces the risk, I haven't seen a study that quantifies it that way. Pretty much every expert that I've heard talk about this says that the reduction in rates of hospitalization, ICU admissions, and deaths is very significant.
Just to be clear, that's just with the 2 vaccines, correct? That's just with the first and second vaccine, not the booster.
Yes.
Kind of going on to that with question number 3, what are some of the benefits from getting the COVID vaccine that you've experienced?
When you ask that, you mean me personally?
Like you as a physician seeing your patients, and if you receive the vaccine, you personally also.
So in my patients, the number one thing that I think is most significant is just the peace of mind that a lot of people get. Mm-hmm. This has been a scary time. I don't want to overstate that or pretend like it wasn't. This has been we have this new virus that's affecting the human population. No one has seen or heard of it before. A lot of people have died from this virus. And so, I had a lot of patients personally that were worried about it. And so the biggest thing was the peace of mind that they got, knowing that regardless of what's going on around us right now, they have a level of protection that, while it isn't 100%, it does make them a lot safer than they would be otherwise, particularly if they have risk factors, which most of my patients do.
And kind of adding on to what you said earlier, did you receive all your COVID vaccines?
I did. Right now, I would be considered up to date on everything because not only did I get my 2 vaccination series, after that, I had a COVID infection. After that, I was one of the people that when the Omicron variant came around, it was different enough to what I had been, seeing before, to where I received an infection. So when you look at the CDC's website, they consider that someone who's fully up to date.
Wow. Okay.
Yeah.
So, last question. Is there any other information on COVID-19 that you would like to give us today?
Yes. Information that I wish everyone knew or everyone spent a little bit more time thinking about was risk factors, right? I think a lot of my patients are not assessing whether they are at risk for ending up in the hospital or possibly dying from the virus that's going around right now still. Because you have to keep in mind, I think in the state of California, 24 people a day are passing away from this. In the county that we're sitting in right now, there's still, what's reported is 2 to 3 cases every single day. Now, our hospitals are much more clear. Our ICUs are not full of patients, so it's better in that sense. But if you're older than 50 years old, if you have chronic lung disease, chronic kidney disease, if you have heart disease, if you have asthma, if, when it comes to what are known as the social determinants of health, there are certain race categories that have been severely impacted by this virus. There are certain socioeconomic status, which basically just means, the income that's coming into your family. How many people are living in your home? Things like that I don't think everyone thinks about are still creating a lot of risk for you having a really difficult time with this virus. So we have a lot of people here that can go through these risk factors for you in detail. There are online resources, and to just really be mindful that this disease is still very much out there and still hurting a lot of people and a lot of families today.
So do you think if people had any questions about getting the COVID vaccine, the best thing would for them to be come in, ask questions, and then possibly if they would like to get the vaccine, we'd be able to offer that to them?
I think that's a fantastic idea. I would recommend anyone that is worried about what's going on right now, which really should be all of us, to come into the clinic as soon as you can and either find me. We've got a lot of other people here that are also seeing patients. We've got Carrie here, who's pretty much the lead on our COVID effort, that can answer any questions that you have and give you the vaccine.
Perfect. Thank you so much, Dr. Banani.